Welcome to this channel. Please like, subscribe.
Hello everyone, welcome back. In this video we'll be talking about the cardiac cycle. Now, what is the cardiac cycle? The cardiac cycle is a series of activities that take place for a single heartbeat. That's what the cardiac cycle is. Now, before we can be able to understand the cardiac cycle properly, we need to know what the chambers of the heart are. We need to understand the chambers of the heart and how blood flows through the heart. Now, basically, we have four chambers of the heart. We have two atria, call one an atrium. We have two atria at the upper side of the heart. Then at the lower side of the heart, we have two ventricles. Now, dividing the atria and the ventricles, we have what we call atrioventricular valves. Dividing the right side of the heart from the left side of the heart is what we call septum. Okay, what happens is that how does blood flow through the heart? We have the left side of the heart will always contain oxygenated blood, and the right side of the heart, the left side of the heart will always contain oxygenated blood, then the right side of the heart will always contain the oxygenated blood. What happens is that when blood is oxygenated in the lungs, it is brought to the left side of the heart through the pulmonary veins. Okay, it enters the left side of the heart and precisely in the left atrium. That's how oxygenated blood enters the heart. Now, when the oxygenated blood enters the left atrium, it needs to leave from the left atrium and enters the left ventricle. Okay, between the left atrium and the left ventricle, we have what we call the mitral valve or the left atrioventricular valve. When the left atrium contracts, blood will leave from the left atrium, pass through the mitral valve, because the mitral valve will open so that the oxygenated blood can enter the left ventricle. When that happens, the mitral valve closes so that blood will not flow back to the left atrium. So that when the left ventricle contracts, blood will the left semilunar valve will open. So that we call it the aortic valve. You open so that oxygenated blood can leave from the left ventricle and pass through the aorta and supplies the other parts of the body. Okay, after metabolism in the other parts of the body, the blood now will turn to deoxygenated blood. The deoxygenated blood has to come back to the heart. How will it come back to the heart? It will come back to the heart through the superior vena cava and the inferior vena cava. Okay, the deoxygenated blood enters the heart precisely in the right atrium, because we said that the oxygenated blood fills the right side of the heart. It enters in the right atrium. Now, the right atrioventricular valve, called the tricuspid valve, has to open for blood to leave the right atrium and enter the right ventricle. When that happens, the tricuspid valve closes so that the oxygenated blood will not flow back from the right atrium to the right ventricle. When that happens, the right semilunar valve or the pulmonary valve opens so that the oxygenated blood can move through the pulmonary artery and goes back to the lung where oxygenation can take place again. That's basically how blood moves through the heart. Now, be seeing normally the cardiac cycle, one heartbeat takes 0.8 seconds, and what actually happens for one heartbeat to take place? This is what we'll be seeing. We'll be seeing the contraction and relaxation of the heart. Contraction means systole, and the relaxation means diastole. So, contraction and relaxation of the heart is also what we call cardiac systole and diastole. Now, how does the heart contract? How does it relax? The heart needs to contract and relax for a single heartbeat to take place. Initially, the atria are relaxing. So if we are talking about relaxation of the atria, we are talking about atrial diastole. Initially, we have what we call atrial diastole. If there's no atrial diastole, blood cannot enter the atrium or the atria. So atrial diastole happens, and oxygenated blood, when the atria are relaxing, oxygenated blood through the pulmonary veins will enter the left atrium, and the oxygenated blood through the superior and inferior vena cava will enter through the right atrium. Okay, when the blood fills the atria, now the atria contracts so that we now have what we call atrial systole. But first of all, let's discuss diastole so that we can come back to systole and describe. Okay, initially when the atria is being filled, when the atria are being filled, the ventricles are still empty, the ventricles are still relaxing. So it is because the ventricles are relaxing that when the atria contracts, you open the atrioventricular valve so that blood can enter the ventricles. Now the ventricles will only contract when the atrioventricular valves have closed and there is blood in the ventricles, so that the ventricles can contract and blood will pass and go to the other sides of the body. Now talking about systole, we have atrial systole, we have ventricular systole. Atrial systole happens when blood enters the atria and there was no blood in the ventricles. When atrial systole happens, the atrioventricular valves open so that blood can move to the oxygenated blood can move from the left atrium to the left ventricle. The oxygenated blood from the right atrium to the right ventricle. That's basically atrial systole. Okay, coming to ventricular systole, what happens is that when blood leaves the atria and moves to the ventricles, the atrioventricular valves, that's the mitral valve and the tricuspid valve, needs to close so that blood will not be moving in the reverse direction. So the ventricles contract now. When the ventricles contract, we call it ventricular systole. Oxygenated blood from the left side of the heart will move. Oxygenated blood from the left side of the heart will move through the aortic valve and go through the aorta to go to the other parts of the body. First of all, when the atrioventricular valves are closing, that's when we hear the loop sound of the heart. That's when the atrioventricular valves are closing. Okay. Now, when the right side of the heart, when the right ventricle contracts, the pulmonary valve opens, which is the right semilunar valve, so that the oxygenated blood can pass through the pulmonary artery and goes to the lungs for oxygenation. When these pulmonary valves, the aortic valve and when this semilunar valve, that's the aortic valve and the pulmonary valve, they close, that's what causes the doop sound of the heart. That's why for each heartbeat you must hear loop doop sound. Okay, and this complete atrial systole, diastole, ventricular systole, diastole takes place for 0.8 seconds. That's basically what happens during a single heartbeat.